Yes, Pastor. Okay, good evening and welcome to another Total Transformation Seminar. We thank you for joining us once again this evening. Okay, just making sure I'm on. Okay, all right, so I'll start again. Thanks for joining us this evening for another Total Transformation Seminar. We're so glad that you can join us as we've been broadcasting for the last 7 weeks, and we're so glad that you can join us again this evening. We have 3 guests with us this evening who I'd like to briefly introduce. We have Professor Andrew Baildam, who's a consultant oncoplastic breast surgeon, so we're so happy that he could be with us. And we have Dr. Jackie Lewis, who is a retired GP and a nutritional researcher. And we're also joined by Nana Opoku, who is a public health practitioner. And she's an engagement and delivery manager for the Greater Manchester Cancer Screening Engagement Programme. So once again, we welcome the 3 of you to our seminar this evening and look forward to what you have to share with us. Just a few reminders for us all. During the presentations, if you have any questions, please place them in the chat, okay? And they will be picked up. Nana is our moderator this evening, and she will pick up the questions and she'll present them to Jackie, to Dr. Jackie and to Professor Baildam. So we hope you enjoy tonight's seminar, and I'll hand over now to Nana. Thank you.
Thank you very much for inviting us this evening. We are so excited to be here. We are going to talk about the big C, that is cancer. We have an able professor with us who is just going to start us on, and I just want you to just stay in your seat, and please let's pay attention to Professor Andrew Baildam. Prof.
Thank you very much. So the first thing I need to do is to share the screen, and that means going on to my PowerPoint, which should be here. So can you see my PowerPoint?
Yes, we can.
How's that?
Yes, that's good.
Perfect. Right. Well, I'm going to go ahead and give you a little talk for about 25 minutes. Reducing cancer risk and early detection. It's been a passion of mine for the last 25 years. My background is I was a consultant surgical oncologist at the Christie Hospital, dealing mostly with breast cancer. And then in the last 15 years, entirely with breast cancer. I went to Barts in London in 2011 when they appointed me professor down there. After 36 years, I left the NHS, having done my real whack full time, but I'm still working. I'm still doing a surgical practice in Manchester and in London. And I also still do a lot of teaching and a lot of training, and I still love it. So let's talk about cancer risk and early detection, because you can't really separate those two. If we go on to the next slide, what is a cancer? Well, I think it's quite important to think of what a cancer actually is. Now, our bodies are constantly recreating our tissues. So the same body that you've got today is not the same one that you were sitting in 10 years ago. Cells all the time in the body are being produced and are being absorbed. So cell growth is going on. And when cell growth in a normal part of tissue becomes uncontrolled, the cells can acquire the ability to multiply, and they're not switched off by the body's normal mechanisms. Part of that is the immune system. And eventually the cells become a tumor growth, and they then can acquire the ability to invade normal tissue. And when they've done that, they can spread through the body via lymphatics and via blood. Now, you may think that this is a completely abnormal situation, but it isn't, because if you consider just for one moment the miracle of conception and the miracle of pregnancy, that is a cell which is not the same genetics as the mother nor the father, it's a mix of the both, but that cell has the natural ability to invade the normal lining of the uterus and then to lay down blood vessels and to grow. So it's behaving in a normal way, and it is that normal way that cancer cells can learn to behave, and they can spread through the body if they invade via lymphatics and blood. It's where that system has gone wrong. Now, cancer can cause a lot of disruption and death by spreading through the bloodstream and then going to other organs in the body, particularly liver, lungs, brain, and bones, can obstruct the bowel, can obstruct blood vessels in the urinary tract. But interestingly, hardly ever do cancer cells invade muscle, the heart muscle, or connective tissue, or even fatty tissue. Now, there are a lot of things that you can do with your lifestyle which can reduce your cancer risk: stopping smoking, eating a healthy diet, keeping fit, drinking no or less alcohol. But it's also important in terms of detection to know your body and recognize changes such as lumps or bleeding and get advice about whether they might be serious. And I know the speakers are going to talk about that a little bit later. Every year, about 180,000 people in the UK die from cancer, but since the 1990s, survival rates in men and in women have improved for most. There's no 100% way to prevent cancer, but you can reduce your risk. And I'm going to keep mentioning these main risks because it's smoking, it's being overweight, and a few other things that you can do. And stories about foods and diets are often in the news. A lot of research is going on into diet and cancer, but you can't easily study the link because there are so many different factors involved. And cancer itself can take years to develop. It doesn't always, it can develop really very quickly. But that gives you a clue that cancer is not one disease. Cancer is a whole mixture of different diseases which can grow at different rates. Some cancers can be very much like normal healthy tissue. They're just behaving in a slightly abnormal way. Other cancers are so different from normal tissue that they grow really quickly and they can spread rapidly, and someone can succumb quite quickly from it. So that's the important point. Even breast cancer is not one single disease. It's at least 27 different types of diseases, and no single food or supplement can prevent it from developing. There are certain food groups and certain vitamins that can lead to a reduction in cancer risk, and eating a healthy, balanced diet can lower the risk of breast cancer. Now, what is a healthy, balanced diet? It's fruit and vegetables. It's at least 5 portions a day. I know when the government came out with 5 portions a day, what they really wanted to say was 15 portions a day, but that's impossible to get people to do. So 5 was what they pragmatically went. Whole grain foods where possible, as they contain more fiber, less carbohydrate, beans, non-dairy sources of protein. You need some protein. So if you're not getting enough protein from non-dairy vegetable sources, you need some meat, some fish, you need some eggs, milk, and dairy foods. And you need a little bit of fat. So you also need a little bit of sugar, because we need a bit of fat and sugar to go to the architecture of a lot of our body tissues. So, for example, nerve tissue has got quite a lot of fat in it. And this is one of the most important things, is maintaining a healthy weight. So not quite 2/3 of the population in England is overweight or obese. And that's a problem, because that definitely increases the risk of these: bowel cancers, pancreatic cancers, esophageal or gullet cancers, and breast cancer, especially if you've already gone through the menopause, cancer of the uterus, and kidney cancers. Now, alcohol is known to increase your risk of some cancers, particularly where you drink it, so mouth, pharynx, larynx, but also esophageal, but colorectal cancer in men, and it also increases the risk of breast cancer, and I'll tell you some of the data on that later. Now, we know the smoking story. It's been around now for 40 years, and it's still astonishing that in many parts of the world, a very high proportion of the population still smokes, and there's lots of reasons for that. There's geopolitical reasons, there's commercial reasons, but the reality with smoking is that nicotine in smoke is one of the most highly addictive drugs that there are. Nicotine is far more addictive than heroin, for example. And stopping smoking greatly cuts the risk of getting lung cancer. And the earlier you stop smoking, if you are a smoker, the greater the impact. It used to be said, when I was a medical student, it used to be said, oh, I've been smoking for 30 years, doctor. And the doctor would say, oh, well, 30 years, there's no point in stopping now. But that absolutely is not true. And people who stop smoking within 3 to 5 years can have cleaned up their lungs. It's your body's ability to repair that recycling that I mentioned 5 minutes ago. It's quite extraordinary. What about sun damage? Well, this is a big one recently, because what we do know is that getting burned in the sun is a really important factor for developing skin cancer later on. Now, looking out of the window now, some of you probably think I'm just telling you a joke, because there's not much sun going on at the moment. But last year there was, if you remember, we had quite a nice sunny time in May and June and July, which was just as well because we weren't being allowed to do very much else at that time. But if you do go in the sun, keep in the shade, cover yourself up, take care particularly not to get children burned, and use a good SPF factor. Now in the where we live, we need it at least 15, but if you're going to go and spend time in the Caribbean, you need 50, 30 at the least. Now, if you look at Reader's Digest, which used to be very popular, 31 simple ways to reduce cancer risk. Well, I think 31 is far too many to remember, so I'm going to finish up giving you about 8. The key to the problem is this: early diagnosis, risk reduction, and prevention. And you can turn these 3 around because they're so interrelated. Let's talk about breast cancer for a little bit. Every year in Europe, 130,000 women die from breast cancer, and 1/10 of those are in the United Kingdom. We used to have some of the worst data for breast cancer in the world. It's the commonest malignancy in women. And in Europe now, 1 in 9 women will get it. When I was a medical student, it was about 1 in 15. It's going up 2% an annum. And it's the second commonest cause of death in women in middle years. Why is it so important? Well, it's not one disease, as I've told you. There are differences in presentation, differences in treatment, and lifestyle change can modify cancer risk. Now, these are the main types of treatment for breast cancer: surgery, and surgery has changed hugely in the last 15 years. And it's been fantastic to be part of that change and to be at the forefront of developing new techniques which are less invasive, cosmetically and aesthetically very natural and real, and a very different picture from 30 years ago. But in addition to surgery, there's the adjuvant therapy. Adjuvant means everything else: the radiotherapy if needed, the hormone therapy, the chemotherapy, the monoclonal antibody therapy. Now, for most people, they do not need all of this, but we're going to talk about individualized care. And breast cancer can spread to other organs, in which point it becomes known as systemic or metastatic disease. And particularly, it can spread to bone, to liver, to lungs, and to brain, and it causes death by damaging those. And the important point is to try and stop a cancer before it's had the chance to do that. We now know that lots of breast cancer is hormone dependent. So we can give estrogen receptor blockers and we can give what are called aromatase inhibitors. And both of these now are being used not just for people who've got cancers diagnosed, but they're also being offered to women who have been calculated to have a very high personal risk of developing a breast cancer. Now, the one that you know of probably more than any other is the BRCA1 gene variant, which is the one that Angelina Jolie had. But you can offer women these estrogen receptor blockers and lowerers, which will lower their risk of the cancer developing. And we've got much more effective treatment, we've got more targeted treatment, but we've also got the earlier diagnosis. And Britain was one of the first countries in the 80s to set up a national breast screening service. And again, we come to the bottom, lifestyle change to reduce risk, both before and after breast cancer. In other words, if somebody has had breast cancer, then lifestyle change will reduce the chance of that cancer coming back and from spreading. Now, I want you to look at this graph. Now, this is a graph which goes up to 2005. And if you look at the solid black line, that is the death rate at the top of breast cancer per 100,000 women in the United Kingdom going back to the 1950s. So this is the United Kingdom, and you can see that from the early 90s, we have had a 1/3 drop in the mortality of breast cancer in this country. Now, most countries have had a bit of a drop, but most of them didn't start quite as badly as where we started. Switzerland is here, and I'm going to talk a little bit more about Switzerland in a minute because that's particularly interesting. That's the difference between 1990 and 2005. It's a 30% drop in the death rate. But in the same period of time, the number of cases has gone up exponentially, as I've shown you. And these are the things that we use to decide which particular disease the breast cancer is. The type, the aggression, the grade, the size. Obviously, a 4-centimeter tumor is very much more important in terms of risk to spread and life than a 1-centimeter one. Whether or not lymph nodes are involved, whether or not they're sensitive to hormones, whether the disease is local or distant as well as local, and whether it's got what's called multiple gene expression in the tumor. So you can analyze the genes expressed in a cancer cell, and you can get particularly the genes that will code for rapid spread, for that invasion of normal tissues, which I mentioned 7 or 8 minutes ago. And these factors together guide treatment. Now, for most people, surgery is still the mainstay of treatment, and huge trials with many scores of thousands of people have determined that that is the biggest bang for the buck. It's the biggest benefit. But then added into that, you may need to add the radiotherapy, the chemotherapy, the monoclonal antibody. But the key to the problem, again, prevention, risk reduction, early diagnosis. We'd prefer not to be doing much of diagnosis because we'd prefer to risk reduce and to prevent. Now, this is a photograph of a mammogram taken through the NHS breast screening program. Conventionally, this is the right breast and this is the left breast. And you can see there's an obvious asymmetry there. That is a tiny cancer. It's detected on a mammogram. You're never going to feel that. It's far too small. It may be another 3 or 4 years before that becomes a big enough lump in order to be able to feel it as a lump. You need to pick it up before you can feel it, and you need to be able to take it out. We biopsy these by using rigs and mammograms and stereotactic core biopsies, and then we put guide wires in to the breast before removing the tumor surgically. And there's the tumor out accurately localized, and the breast is left intact and to all intents and purposes should look normal after this operation. So an early diagnosis can cure people. What about this family? This is a family who you can see 3 generations, and virtually all the women in these generations have had breast cancer. And what do you advise a woman like this, who is bookended between relatives with cancer but hasn't had cancer herself? And that's the situation that Angelina Jolie was in, because you can calculate some of these families have got breast cancer related genes. And if you do, then you have to be able to reduce the risk. And the route that she took was having risk reducing surgery with primary oncoplastic breast reconstruction. So reducing risk is about reducing your chance of getting it in the first place, or reducing your chances of coming back if you've already had it. Now, a few years ago, this excellent book was published by Michelle Harvey, who was one of my research fellows at the Christie for a while. And it was called, I think, rather unfortunately, the Genesis Breast Cancer Prevention Diet. Now, apart from the fact that that wasn't a great selling title, there is actually a lot more in this book than just a diet. And what this book did was it summarized all the risk factors for breast cancer, the family history, and could I influence my own individual risk. It was much more than just diet. It was the importance of a healthy lifestyle. All the scientific published evidence was put in there. Now, this was specifically about breast cancer, but the reality is that a lot of cancers have generically the same root causes, whether it's colon or gastrointestinal. A lot of the things are the same link. I've dealt with smoking and tobacco, that's specific to lung. But excess weight increases risk. So putting on 3 or 4 pounds a year for 20 years gives a greatly increased risk of cancer. Vital ingredients of a healthy diet, alcohol, but then this, the importance of exercise. And also the sensible diet and lifestyle choices for women who've already had cancer. Now, this is how excess weight increases breast cancer risk. So this is age here, going up to 20, 40, 60 years. Here is the breast cancer rates. So if you're 60, you're much more likely to be diagnosed with breast cancer than you are at 40, and a lot more than in your 20s. But all these risks increase by up to 40% if there is an increase in weight. So at the age of 40, an excess increase in weight, so that you become with a BMI of greater than 30, which is rather rudely perhaps called obese, then that increases your risk by 40%. At young age, it increases by 30%. At older age, it increases by 20%. So a big, big effect of weight. They think that probably a quarter of all breast cancer is due to obesity. And weight gain of 19 kilograms after 20 years doubles the breast cancer risk after the age of 50. And so if you lose weight deliberately, even 3.5 kilograms, which I think is about half a stone, then you've got a 40% less risk of getting it. And people with a 36% fat in their body have got double the risk of those that have 27%. And if you measure your tummy, more than 90 centimeters gives you 40% more risk than a waist of 73. This is all scientifically published and recorded and measured. So it is pretty important. What about alcohol? A unit of alcohol a day gives you an increase of 7% increase in risk. So a daily 250 ml glass of wine, which is about 1/3 of a bottle, gives a 1/4 increase in risk. And the reason is that alcohol increases estrogen and testosterone levels in the blood. As I pointed out, many of these cancers are hormone fueled, but it also makes breast cells more susceptible to damage, which it then can't repair. Now, some fat is essential for health in a balanced diet, and particularly these saturated, trans, and omega-6 all increase risk, but monounsaturated and omega-3 all reduce risk. And these are the good foods that reduce risk. Green leafy vegetables, especially broccoli, spinach. Broccoli has got a lot of a chemical, a natural organic chemical in it called 3-carbinol, which really helps cells repair. Indole 3-carbinol helps cells repair when they need to repair. Particularly the red and yellow fruits and vegetables are also helpful. Also these, grapes, berries, beans, lentils, and beetroot. They also lower the risk of heart disease, which is good. Vitamin D. We've heard a lot about vitamin D during COVID. You can get vitamin D from dairy products, and 2 to 3 portions of dairy food can reduce risk, but you need it not too much, you need some. But vitamin D protects against many types of cancer. And you can get vitamin D, paradoxically, from sunlight. So if you live in a hot country and you wear clothes that cover you up all the time, then the chances are your vitamin D levels are going to be really, really low and incomplete. But you can get vitamin D products. What about exercise? Regular exercise reduces risk by 30 to 40%. And look at this. Lack of exercise has been calculated to account for that in Western societies. 3 or 4 hours a week of moderate walking or vigorous exercise is recommended. It can help your hormone balance as well. And these vitamins are all important. C, E, A, and D. Selenium may protect against some cancers. And the trouble with high vitamin C is that high vitamin C, more than 1 gram a day, every day, actually can cause some damage. Folic acid is also helpful. There's a lot of other books that have been published. This was quite interesting. Professor Jane Plant, Your Life in Your Hands, Understand, Prevent and Overcome Breast Cancer and Ovarian Cancer. But this is less of a scientific paper than this one, but it's still quite useful. Just don't take every line in every book as being absolute gospel. This is a photograph which was taken in my operating theatre quite some years ago when I was teaching, and I was teaching these surgeons how to do particular operations. And I love this picture because I think it's a bit iconic. And the truth is, we don't have theatres like this anymore where lots of people are allowed in. We probably only allow no more than 2 at a time these days. But surgery is still the most important treatment. And the challenge of screening is this, that every year, as I said, 13,000 women in Britain die from breast cancer, 1,500 in Switzerland. Now, why do I mention that? Because this was a paper published about breast cancer in Switzerland. And what it found was this: if you lived in Basel and Zurich, the yellow line, orange line, your chances of dying from breast cancer were much higher than if you lived in the French-speaking part of Switzerland, which is this line. And these are the mortality over 20-odd years. What was the reason? Why was there such a big difference depending on which half of Switzerland you lived in? Because the lifestyle was very similar. Well, the difference was this, that the Swiss healthcare system was financed by canton, not nationally. And Zurich and the German-speaking cantons elected not to fund mammographic screening in the early 1990s. That's simple as that. That's what it was. So they had small breast cancers not being diagnosed and not being treated. And they estimated that was giving 300 excess deaths in Switzerland annually. Any benefit of adjuvant therapy is measured by that conferred by surgery. Now, this is a busy, busy slide, and I'm not going to go through it and explain it all, but the advances in the treatment of cancers has been gained at the cost of huge randomized controlled trials. And these are just 8 of them with their acronyms over the years. And this is the way they randomized treatment. And then they simply sat back and waited and measured the deaths in each cohort. And that's how the improvements have come about. And they're published with graphs like this. So this is comparing 2 medicines and hormones, anastrozole and tamoxifen. And here you see, this is the time after diagnosis. This goes up to 4.5 years. Here are the women who were treated with anastrozole after surgery. Here are the women who were treated with tamoxifen after surgery. And you can see at 4 years, there's a difference. And those getting the anastrozole did better. But look at the numbers of patients in the study. We start off with over 5,000 patients. And this is how you know that this data is real. And this is the kind of work that has been going on year by year by year in all the different types of cancers to try and just edge forward that cure rate. It's not just about finance. Although that is different. In the USA, it's actually 16% now of their GDP to provide health cover for 80% of the population. We spend around 10% for the whole population, and we are 10th in the European Spending League. In the US, breast cancer is going down, and it dropped after the HRT use came down. But that apparently only accounts for about half the reduction. We think the other half is because of lifestyle changes. There's also huge differences in treatment across the world. So, for example, if we look at mastectomy rates in France, they're very low. In the Netherlands, they're extremely high. Radiotherapy after mastectomy, 12% in Japan, 90% in Belgium. So there's cultural factors. It's not just the scientific data. Every country has an independent variable in the multivariate analysis, and there are huge challenges in interpreting highly complex patterns in even basic cancer treatment. So when it comes to personalized treatment, everything is now moving in that direction, but it is becoming increasingly costly. So if we take a group of people all with a cancer, we start to separate them out in terms of genomics to see who's going to get the best treatment in the what category. And the Oncotype DX is a molecular score that you can look at in breast cancer cells, but it's highly expensive. But it can definitely show you the individual treatment. I'm going to move on now. And this is just a complicated slide to show you one group of breast cancer patients are benefited by something called Herceptin, which these cells have turned on by human epidermal growth factor receptor, and blocking those for patients who still got some cells around can increase the cure rate. Aging population, the older the population is, the higher the risk of getting cancers and the higher risk of deaths from cancers. So as people get older, they become increasingly likely. So the aim has to be to get fewer patients with cancer, ideally, and for those with cancer, earlier diagnosis and better structured therapy. For very high risk groups, such as gene variant carriers, you can offer risk-reducing surgery and reconstruction like Angelina Jolie had, or a hormonal blocker. For lower risk people, it's got to be lifestyle. Excuse me. So Harvard Health advice was this: avoid tobacco, eat properly, exercise regularly, keep your weight steady, avoid alcohol, have vitamin D, and also some vaccinations like human papillomavirus. Very important to get vaccinated to lower the cancer risks associated with those. This is the World Health Organization, which just summed that up quite nicely. Don't smoke, make your home smoke free, healthy diet, breastfeed, reduces mother's cancer risk, vaccinate your children against Hep B and hepatitis and HPV, avoid too much sun, reduce air pollution, be active, limit alcohol, and take part in organized cancer screening programs. Thank you very much for your attention.
Thank you very much, Professor. I'm very sure you should be clapping in your house because I was so excited that I've gotten to listen to Professor this evening. It's so much packed with a lot of information. I was able to capture those 10 things on the WHO slide. I don't know if you all did, but if you didn't, after the session, we'll probably ask Prof to put it up again. I have a few questions popping up already in the chat. I will be getting on with the questions very soon. Keep putting them in, and I'm definitely going to try my best so that within the next couple of minutes, we should be able to answer a lot of questions. I'll go straight onto the chat, and I'll start with the very first one. Okay, so the very first one I have here is, at what stage can breast cancer be detected by a mammogram or ultrasound? And how often can you have a mammogram? I think both are for us.
Like everything, mammography is changing. It's now done entirely with computers, very, very tiny doses of radiation, very much less than in the 1990s. And as the change occurs in the technology, it gets better and better. Now you can pick up a tiny breast cancer when it's about 2 to 3 millimeters now. Now, a mammogram will pick up microcalcification, which cannot be picked up by an ultrasound scan. An ultrasound scan is not as good as a mammogram for most people. It adds information, but it doesn't replace a mammogram. So if you find something abnormal on the mammogram, you can have an ultrasound to target it. Now, it gets a bit complicated with younger women because a mammogram is not very specific and sensitive before the age of 35. So in a woman less than 35, you would tend to do an ultrasound scan first, but you wouldn't tend to screen those women because their incidence of cancer is so tiny and so low. But if a woman of 28 presents with a lump, you'd do an ultrasound scan first. Now for screening, the NHS offers a screening mammogram every 3 years to women over the age of 47. We know that every 3 years is too long. And many countries do screening over the age of 40, and they'll do it every 2 years. Sweden does it every 18 months, and they have the best data in the world. But it's a cost-benefit analysis. It's not just the ability to do the test, it's the economics to fund it.
Wow. Okay. So there we go with the mammogram. We go straight to the next question, and it's about Black men. I think this is something very close to the heart of a lot of people here this evening. And the first question about Black men is, what places Black men particularly at high risk of prostate cancer, and why? Off again.
It's a very interesting question. And the answer I'm going to give to you is an answer that comes from observing what is happening in some other countries in the world. It's not an answer that has been funded in a big scientific study. So you need to say, this is an opinion, it's not a scientific fact. I've referred you in the talk to some of the breast cancer related gene variants. The well-known ones are BRCA1, BRCA2. The BRCA1 and 2 are both inherited. They can be inherited from the father, not just from the mother. I have one patient who inherited one of the variants from each of her parents. So she got both. Now, the other breast cancer related variants are like TP53, PALB2, but they're rarer. Now, if a young woman, it'll come obvious in a minute why I'm using this to answer this question, I hope. A young woman who gets breast cancer under the age of 35 has approximately a 25 to 30% chance of having one of these breast cancer gene variants. If you go to the older age, the 60s, it's more like 5%. So the younger age relates to these. Now, these variants also relate to prostate cancer, and there is an increased risk of these families with the BRCAs of having highish numbers of prostate cancer, not in the same percentages of breast, which in BRCA1 is 85%, but the prostates will be less than half that, but they're still significantly high. If you look at breast cancer overall in Britain and in Europeans, the risk of having one of these gene variants overall is between 8 and 9%. If you look at women with breast cancer in some of the Afro-Caribbean populations, the risk of having one of these genes is more like 30%. And if you look at individual countries, extraordinary. Interestingly, the risk of BRCA2 is also extremely high in Iceland, which is a very small population. They've got their own BRCA2. Now, all I'm thinking is that if these BRCA genes are prevalent, then that might account for the slight increased risk in prostate cancer, but that has not been scientifically validated yet.
Okay, thank you very much. We'll move on to the next question so swiftly. I can see a lot of questions around diet. I'll hold on to those a bit because we'll have Dr. Jackie Lewis, who's also into nutrition, to also help us when we get to those ones. So let's go on to the next one I have on my screen here. It says, if cancer begins so small, how can we realistically find them and neutralize them early to make that difference? Prof.
Yeah, I mean, your body is constantly making abnormal cells. And what your body does is your body finds them and scavenges them and gets rid of them. So the lifestyle factors are things that aid your body's scavenging system. And those are the best things that you can do. So if you have a high risk from being a little overweight, then the best thing you can do is to get your weight down to more of an average for your height. That is because that will help your immune system to function. If you like a bottle of wine, try and dislike a bottle of wine, put it away, don't touch it, because that will harm your immune system. So our bodies are constantly producing rogue cells, and we have to help our bodies destroy them. And that's the best we can do. Obviously, there are certain toxic environments. There are some jobs people do which sometimes are high risk because they're using chemicals and things like that. So health and safety, make sure that those things are taken care of in the workplace and you get the most protection that you can from it.
Fantastic. I remember you saying, Prof, that no vitamins or supplements can prevent us from having cancer. But I have someone here asking, what do you have to say about herbal treatment for cancer compared to chemotherapy?
Yeah, I mean, how can you treat breast cancer naturally without having an operation or chemotherapy? Well, unfortunately, very sadly, I have seen in my career now, which is as a consultant, it's over 20, is it 25 years? Something like that. Yes, it's over 25 years now. It's extraordinary. I have seen many, many, many thousands of patients that I have treated. And I have seen many who have said, I don't want conventional treatment. And what happens is they will often do lifestyle changes. So they'll lose weight, they'll take vitamin D, they'll do lots of exercise, and they will work and work and work and work. And very often, the primary cancer will reduce in size, but it will never go away, and it will learn to live with the lifestyle changes that they've made because you haven't removed it. In other words, the stem cells have become accustomed to the changes that you've made, and then they flare up again. And I'm very sad to tell you, I have never seen one single patient survive who refused conventional treatment. Now, there's all sorts of different types of conventional treatment. There's not just one, because there's all sorts of different types of breast cancer. But sadly, although it's sometimes you get early benefit and early change, that is never long lasting, because you don't get rid of the core, you don't get rid of the stem cells. And it makes me really sad when I see people who I know are curable who refuse conventional treatment, because it's a real risk to take. Wow. I mean, there is a menu, you've got a choice, and it should be, it should be explained carefully and sympathetically. And obviously, I always respect my patients' choices, but I know when people can be cured by this, in quotes, 10-year disease-free survival. And the saddest thing is when people try and do it entirely by what they call alternative methods, and when that fails, they blame themselves. They say they didn't try hard enough. And that's really bad. That's really bad. There are also people who take advantage. So there are people who will take lots of money from you for giving you a lifestyle menu, and the menu rules your life. You have to have so many milligrams of magnesium at 2:10 on a Tuesday and things like that. And then when it doesn't work, well, you just didn't try hard enough, which is a double tragedy, really. So it makes me very sad. I've not known a single person who's tried to treat it naturally and has overcome it long term.
Well, so that means that we all have to listen to the advice of our doctors when we are told to do so, because we don't want to lose our dear loved ones who are hearing Paul this evening. So yeah. There is another question about diet, and probably that would lead us on to listen to our second speaker, but I'll bring that question in to start off with. There's a question that says, you mentioned, Prof, that we need a bit of sugar. Do you need sugar from fruits or take sugar?
Well, I think from fruit. I mean, it's a... the less refined foods you have, the better. I mean, I personally actually don't really like white sugar. I don't really like puddings as much as I like starters, but I know some people can get quite needing a sweet tooth. You need a little bit of sugar in the diet. I don't just mean white sugar, I mean naturally occurring sugar. Now, I am not a dietitian, and I don't pretend to be. I think maybe yourself or Dr. Lewis may have a more informed advice to that answer, but you need things to be balanced.
Fantastic, thank you very much. So Prof mentioned Dr. Lewis. I haven't introduced Dr. Lewis as yet because we wanted to introduce the diet question before Dr. Lewis comes in. But in our midst this evening, we have a retired GP, a nutritional researcher, and who is also interested in using nutrition and diets to prevent cancer. Prof mentioned that there are various ways we can reduce our risk of cancer, and one of that is having sensible diets, a lifestyle choice. I wrote that down because I thought that was really good. Sensible diets, a lifestyle choice. So we will spend the next few minutes, it shouldn't be a long time, and just listen to Dr. Jackie Lewis.
Thank you so much, Nana. And let's try if we can also, or do you want to very quickly show the slide, the lemons? We've been talking food. If it's easy to show it, I think it's just so helpful for the audience.
Okay.
Is it quick to show?
I don't have it up now, so you just go.
You don't?
Okay.
And I'll show it. Okay. So I'm going to do screen share as well. Let's see if this will work. Okay. So I slightly differ from Professor Baildam in one respect, and this is maybe the bread question, and I'll explain why. But before that, on the question of sugar, I want to show you a bottle without showing the label of this is a typical cola. I won't say what make, but you can see how much sugar there is if it's not the diet one. So it's at least 8 spoons of sugar per can of cola. And here we have a fresh orange, well, the bottle that did have fresh orange in it, and this demonstrates all the sugar that is in there. So even from natural fruit juice, you can get quite a lot, 4 spoons of sugar in a glass of fresh fruit juice. And so if you can see my slides, you'll see that I agree so much with the professor in almost everything on diet. And indeed, I've met with Michelle Harvey, who the dietitian, who he so recommends. And she wrote also a fantastic book, which I recommend, called The 2-Day Diet, which was the precursor, came before the one that Michael Mosley came up with. So a lot of people are familiar with 5-2 diet, but Michelle Harvey actually came up with this concept, and her book, 2-Day Diet, is excellent. So avoiding being overweight is essential for reducing risk. We've said over and over again. And here I have, this is what 5 pounds of fat looks like. It's a bit horrible to see, and it would be okay if the extra fat just went round your hips and your thighs. It wouldn't cause us bother, but unfortunately it squeezes round our internal organs, around the liver, around the pancreas, around the heart. And it's the pancreas that's one of the big issues, because if you're carrying extra weight, you're at higher risk of diabetes. And if you get pre-diabetes or diabetes, which unfortunately are higher in Afro-Caribbean population, then there is more chance of cancer. Diabetes does increase the risk of cancer significantly. So I tend to say, try and avoid sugary foods as much as possible. As the professor says, a little bit of sugar, okay, but I have virtually cut it out of my diet. But I tend to say, cut down on starchy carbohydrate as well. So that's your bread, rice, pasta, potatoes. But Professor Baildam, he emphasizes fiber, and you can get fiber from other sources. So Michelle Harvey, for example, recommends one can get packets of ground flax seeds, and that's a fantastic source of fiber, high in omega-3. And you can get plenty of fiber from greens and from nuts and seeds. But the issue with these starchy carbs, like your bread, rice, and pasta, is that starch is like a chain of glucose. Imagine a string of beads, and each is a glucose. And your digestion will release the glucose into the blood, and this will put blood sugar up. It's not as bad as table sugar. Someone said, are we recommending Tate and Lyle? And we're not recommending table sugar at all. But even by having a large plate of rice, this will put up your blood sugar as much as if you had 10 spoons of sugar, and you would certainly not spoon sugar all over your meal. But then when you have a rise in your blood sugar, this is followed by a rise in your insulin. And if this rise in insulin is prolonged, then that is going to make it very hard for you to lose weight, because it traps fat in the fat cells and it increases the risk. If you're doing this all the time, having lots of high carb meals, which can be a staple of an African diet, then you are putting yourself at more risk of diabetes. Michelle Harvey talks about fasting as being good, more fruit and veg, obviously, fermented foods, herbs and spices, and as much fresh as possible, and try to avoid packaged foods, especially things like packs of crisps and all these things that the professor has recommended, exercising, reducing alcohol, avoiding smoking, so important. So I'm just trying to move my slide on. Excuse me a second, I may need to move it along a little just to allow it to. Apologies here. Here we go. So Professor talked about mammograms, and I do also want to say, please don't be put off mammograms. I saw from the chat that people had some concerns about them. As the professor said, we've seen the rate of deaths from breast cancer dropping significantly. So about 1,300 lives are saved in the UK each year because of mammograms, and the amount of radiation you're exposed to is just a sixth of everyday exposure. So just the kind of things you do normally, just eating, drinking, going in and out of buildings. There is in a year a very small background radiation, very, very small, and the amount from a mammogram is a sixth of that. So it should not put you off having that mammogram. This is something, going back to the diet, this is something I really wanted to explain. And I recommend this book, as I recommend Michelle Harvey's book, because look at the effect of different foods. It's such an eye-opener. Look at the effect of different foods on your blood sugar. And if it's a meal that is high in starchy carbohydrates, high in rice, high in plantains in this one, it puts up the blood sugar to a staggering amount. And if you're regularly eating large amounts of these kind of foods, you are putting yourself at risk for diabetes and for weight gain, and ultimately for more risk of cancer. So this is a message I just so wanted to put across. So it is possible to eat an Afro-Caribbean style diet and still reduce these starchy carbs. I tend to say, don't have a bed of rice, have a pillow of rice. Just have a little on the side. Don't have a big lot of potatoes, just have 2 or 3 new potatoes. And when it comes to bread, I would only stick to maybe 1 slice in a day of a good whole meal bread. But even that's not essential. Many people now are cutting out bread to try and help lose weight, and it can make it easy to lose weight. But this is to show CT scan and the fact that the risk of this is low in comparison to other risks. So please don't delay treatment, don't delay investigation for fear of x-rays, for fear of mammogram or CT scan, because if you want to get cancer treated, picked up early, treated fully, then don't avoid these things for fear of the x-rays. And we spoke briefly about family history. And so if somebody has either 2 very close relatives with breast cancer or ovarian, because they are linked, or if there is one member of the immediate family who has developed cancer at an early age, has cancer in both breasts, has male breast cancer. There was a question in chat about male, and it is possible. In fact, my own grandfather had breast cancer. So very important if a gentleman feels a lump that he gets it checked out. Or for people who've had cancer in childhood, there can be increased risk in later life, especially if they had radiotherapy. And my last slide is just to say, to reiterate what the professor said, that healthy foods and vitamins, they are really good for prevention, but if you actually find a lump, don't try any home treatments. Don't think that healthy eating is going to get rid of it. The sooner you present, the sooner you can get it removed, and the better your outcome should be. So if in any doubt, please try to get it checked.
Thank you very much, Dr. Lewis, for adding on to what Prof. Baildam has already said. There is a question in here which I think Prof can help us with. This has to do with cow milk and breast cancer, because we know Prof is a specialist with breast cancer. Prof, is there any relationship at all between cow milk and breast cancer?
Oh, you're on mute.
Yes.
Yeah, there we are. I'm unmuted. I think the answer to that question is uncertain. Jane Plant, in her diet advice in her book, advises people to avoid all dairy products. But Michelle Harvey doesn't say that. Michelle Harvey says that there is evidence that you need a little in order to get the calcium and the other factors that's in there. I don't know what Dr. Lewis thinks on that one. I think there definitely isn't a causative relationship between the two. I think there are other things which dairy products can increase your risk of, so cardiovascular disease and so forth. But as I say, the Jane Plant and Michelle have different views on that. I enjoyed what Dr. Lewis said immensely, and I will sadly reduce my bread and potatoes after that. But yeah, you're right, actually.
Thank you very much. I'm laughing because I'm also going to do the same. I've just learned something new. I eat the plantains, the potatoes, and the rice. So thank you very much for bringing that to attention. There's another question about HPV vaccination, Prof. Somebody is asking if you recommend that children take the HPV vaccination at all.
Yeah, again, I'm not an expert on vaccination and public health, but it depends where you draw the age for doing HPV vaccination. There is a protocol for vaccinating kids for HPV, and there is absolutely no question that the human papillomavirus is central to the development of some gynecological cancers. It's also central to the development of some throat cancers. And I spent some time as the president of the British Association of Cancer Surgery. And during that time, Mike Richards was the so-called cancer czar for the country. And I had meetings with Mike Richards every 3 months. And I remember when this whole discussion came up about vaccination for HPV. And in the countries that have instituted it, the incidence of gynecological cancers has absolutely dropped off, cervical cancer particularly. And there is a very strong argument for offering it to the males as well as the females in order to get the incidence of oropharyngeal cancer down as well, which is also HPV related.
Thank you very much for that answer. There's a question here, but I'm quite wary of the time because I know we've gone beyond the 8 o'clock mark. And so I just wanted to find out from Leroy, is it okay for us to carry on a little bit beyond the 8 o'clock mark?
Yes, another 5-10 minutes. Yeah, that should be fine. Yeah.
All right then, because there are little bits in here, I think people want to know, this is more of an African Caribbean community, I can say, because I think people saw the picture on plantain, and there's a picture here about, is it possible for us to rather boil or steam the plantain rather than frying it, because there are other good ingredients or antioxidants in there. What do you say, Dr. Lewis?
It would be possible to do that, but from a point of view of impact on one's blood sugar, it won't reduce that. So there are other ways to get lots of antioxidants. For example, one of the best ones is to have green tea, if people like it. And the professor mentioned the red and purple vegetables and fruits, and those are very high in antioxidants, really fantastic. So berries, for example, are absolutely superb, but unfortunately plantain, which is so popular, but it is relatively high carbohydrate. So many foods have some benefits and also some detriments. And I'm not saying never have any plantain, but maybe just keep the portions small.
Okay. There is a question here about immune system, Prof. There's a question that says, does having a low immune system put somebody at high risk of having cancer?
That's true.
Okay. So I think the answer is true. If you have a low immune system, it puts you at high risk. Then there's another question here, still talking about what we can do in terms of getting our cancer treatment done. And there's a question saying, are there complementary methods to what, Prof, you've said, which might be helpful in controlling cancer?
Well, I think the complementary methods are the things that we've all been talking about, really. So if somebody is diagnosed with a cancer, you can definitely help your body recover by doing the things that we've talked about. Lots of fresh fruit and vegetables, green and colored vegetables. I do think, and I do recommend that my patients go less dairy and less red meat, less alcohol, all those things. And they definitely will give your immune system a boost, assuming your immune system is normal and will normally recover.
Okay. So we were given 5 more minutes, and I think we have just 1 more minute to go. Dr. Lewis was just talking about some lemons, and I'm just going to show the lemons now. I think it's for our sisters, basically. So we'll try and show the lemons so that you would understand what Dr. Lewis wants you to say. It's all about we trying to prevent breast cancer. And I know that this is a topical issue amongst the Black, Asian, Caribbean society. So I'll show you the lemons and then let's see what we can get out of it. Just it will be ready soon. It's coming up soon. Okay, so I'm going to share my screen now. Okay, so I have on the screen here a pack of melons. Okay, 1 minute. I think everybody can see it now. We want to send home some message, and we want our sisters to know this, because we know that COVID has impacted on a lot of services and a lot of people are still scared to even go to the hospital. But we want to encourage everybody here that if you have anything unusual about yourself, or you feel there's something unusual, please don't be put off by COVID. Please contact your doctor as soon as possible. If you are invited for any screening appointments, please don't put it off. Please go for your screening appointments as normal. The NHS has put in a lot of measures to make sure that, yes, we are protected and we are going to be protected from everything that is going on around us. But for our sisters, we want you to keep an eye on this. This is a box of melon. I found it on the internet and I thought it was really great to show it to everybody. It just shows a typical picture of how the breast looks if something is not really going well. So for breast cancer, these are the signs, and these are the signs that some people would pick up. If you find any bumps, any growing veins that was not there before, or if you have any retracted nipple, if you have any change in shape, any discharge, any puckering, any indentation, any sores, any fluid coming from any part of your breast, please don't stay at home. We want you to report your doctors immediately, and something is going to be done about it. So I just want to say a very big thank you to all our speakers this evening. We've had Professor Andrew Baildam, who is very, very busy. In fact, when I saw Professor's biography, I was wondering how he managed to make time for us. And that shows that indeed he really cares about us. So we really want to say a very big thank you to Professor Baildam for spending 1 hour with us and for taking us through everything that you did. I can see that your presentation was fantastic. I have benefited so much from it. And I hope to tell my friends and colleagues when I leave here about everything we did. We also want to say a very big thank you to Dr. Jackie Lewis. Dr. Lewis is passionate about nutrition, and he saw what he showed us. So we want to say a very big thank you to everybody who came here this evening, and I'll hand over the baton back to our brother, Leroy Taylor. Thank you.
Okay, thank you, Nana, for that. And can I join in and say a big thank you to our 3 guests this evening. And we appreciate you being with us with your busy schedules. So it was much appreciated. So thank you once again for joining us.
Thank you.
Next week, we continue with the cancer theme, because next week our theme is prostate cancer, what men should know. And this will be presented by Liebert Hughes, who has made a presentation for us before. So we look forward to seeing you next Monday evening, again at 7 p.m. for another in our Total Transformation seminars. And finally, could I just ask all the presenters if you could just stay behind just for a few minutes after we close. So thank you all once again, and see you next Monday evening at 7. Good night.
Thank you.